What's up, beautiful people? Another day, another study. Neuroinflammation is a key pathological factor in development of dementia. A class of viruses known as herpesviruses can remain latent in the nervous system and they can reactivate later in life. And this can lead to neuroinflammation. Chickenpox or varicella or shingles is one of these viruses. So, clinical and subclinical activation of this virus can cause inflammation in the central and peripheral nervous system, and we know that the varicella virus itself has been linked to amyloid deposition, tau protein aggregation, and detrimental cerebrovascular effects. In fact, these are key pathological findings in the development of Alzheimer's dementia. And we also have previous evidence suggesting that the shingles vaccine may help prevent new dementia cases. In fact, a quasi-randomized controlled trial estimated that shingles vaccination prevented 1 in 5 new dementia cases over a 7-year period. We also have U.S. retrospective studies, chart reviews showing that those who got the shingles vaccine had a lower risk of dementia than those who didn't. So this study was a follow-up on that. They looked at birth date and eligibility to receive the vaccine and use that to do a quasi-randomized controlled study, looking at mild cognitive impairment, which is a pre-dementia state for some people. And they also looked at deaths due to dementia in those individuals who either received the vaccine or didn't. So in their model, there's a 3.1% reduction in mild cognitive impairment diagnosis over 9 years in people who received the zoster vaccination. And those who had dementia, there was almost a 30% reduction in dementia deaths over 9 years in the vaccination group. When they looked at men versus women, women had a stronger effect, men had no effect. So that's interesting, and that may be because previous studies show that women are more prone to reactivation of the varicella virus as they get older. And there wasn't a statistical significance, but the data pointed towards a stronger effect in those who had severe dementia. Now, mechanisms, it's really interesting because we're starting to see the story completely align. We have mechanisms that show why these viruses could cause increased risk of dementia. We know that there may be vaccine-independent mechanisms. So the shingles vaccine may help with immunosenescence. Immunosenescence is when the immune system's function declines as we age. The shingles vaccine is very good at stimulating the immune system. In fact, when I order it for people, I tell them, hey, this is probably going to make you feel pretty flu-like because it does cause a robust immune system response. And that might be a good thing. This may be, in effect, reawakening a dormant immune system. It may also be preventing these shingles reactivations, which leads to the neuroinflammation. So I think this is a very fascinating area of study. I'd love to see more research on this. We're starting to look at other viruses, like there was recently a study about Epstein-Barr virus being a causative factor in multiple sclerosis. So really interesting to look at from a preventative perspective that a vaccine, a widely available vaccine, may help reduce the risk of dementia. And the literature is starting to point a clearer picture in that direction.